equipment like digital x-rays, so you can pull up your x-rays anywhere on campus. You know, in the old days, you would just have to go down and pull the films and all those types of things. You get hands-on instruction. First day you get there, you start feeling the bones for the lumps in the bones and how muscles may or may not be pulling. And all that starts happening from day one. Why delay Sherman? Sherman, if you talk to most people, Sherman's the last true chiropractic college. Chiropractic colleges are 16, I believe, in the country. And we talk about vitalism versus mechanism. Vitalism is where we recognize that there's an intelligence. It's not necessarily a God thing. It's just that there's an intelligence behind the human body and behind life. And we want to release that intelligence so you can express yourself as well as possible. The mechanistic version is you look at one part. You know, my left arm is sore, and so that's the problem. But if you think about what we're talking with a heart attack, you know, left arm pain is pretty common for heart disease people, right? There's the heart in the left arm. You can say, yeah, they. I want to report that, but they're wired embryologically. They're wired very similarly, and that's why you feel the pain down the arm. But it's also good to know that there's a distinct sign of symptoms that you have heart disease, so you can get to the hospital if you are experiencing a higher heart attack and get help as quick as possible. Mechanism is it's the parts, where vitalism recognizes the whole. Does that make sense? Subluxation centered. What you find with some chiropractic colleges is they want to be more like medical doctors. The two are two totally different things, as far as they should be. Anyway, and so chiropractic at Sherman centers on the subluxation. You locate it, you analyze it, you correct it, and get out of the way of the potential in your body. Therefore, medicine, when you have an issue, well, then you go get your medical care for whatever sign or symptom it is. But they're two totally different things. But you have people now that they want to prescribe drugs, they want to do whatever they want to do, but that's not chiropractic, that's medicine. And so my thought is, well, then go to medical school. At Sherman, you got consistent guidance. You have your advisors throughout the time. The professors are great there in that they treat you more like a colleague from day one versus teacher-student. And they want you to be where they're at. And so you can, it's an open door policy. You can get there wherever you want to. Small, close-knit community, I think, on average, at the most, they usually have about 500 students, so it's not a lot. But you know everybody, which is a nice thing. Hands-on experience from the beginning, so you start feeling up and down the spine from day one that you're in the class. Facts about Sherman: it's accredited by the Southern Association of Colleges and Schools, the same one that accredits Clemson. The South Carolina Committee of Higher Education, Chiropractic, has their own accrediting agency. There's chiropractors in all 50 states plus 25 other countries. The nice thing about going to school in Spartanburg, it's an hour from Charlotte, a couple hours from Atlanta, and only 4 hours from the beach. I don't know what the 55% is. So if you've been to Spartanburg, Spartanburg, you can travel to 7 years. The nice thing about going to school in Spartanburg is it's hard to get diverted. You got to drive an hour to go to Charlotte. You got to drive 30 minutes to go to Greenville. So it's an easy way to go to school and concentrate on your studies. As far as admission requirements, presently you only actually have to have 90 semester hours. They're moving towards a bachelor's degree. Cumulative prerequisite GPA of at least 2.7. Then you have to have the C and all your complete classes. You guys have probably had all this stuff as far as the physics, the chemistry, and biological science, and all that type of stuff. They want to have some English skills, psychology, humanities. One of the things that's kind of cool that Sherman does is they have 3+1 agreements. So you go to school for 3 years, that gets you your 90 hours. Then that first year at Sherman counts towards your 4th year at the other school. So you end up with the bachelor's degree while you're going to school at Sherman. You're kind of killing 2 birds with 1 stone. So that's pretty cool. So you get your bachelor's degree within 3 years. And those are the schools that Sherman has relationships with as far as the 3-in-1. So you want to have your GPA of at least 2.5, substantially meets the standard. So, but you can certainly call the admissions department if you do have a question or somebody ever asks you about it. They'll tell you all the answers a whole lot better probably than I could. Most of the people up there are on financial aid, and you just apply for. That's what it is for a year. Wait, hang on a minute. That might be a quarter. Sherman's on the quarter system, so you go about 10 or 11 weeks, and then you get a couple weeks off for a break. That might be a quarter. I'd have to check on that. Because my student loans that I'm paying back are not that cheap. I mean, if you look at medical school and you look at chiropractic college, the amount of hours that you're in school is about the same. So you're in for about 3.5 to 4 years, depending on how quick you get out of there. Yeah, so it was per quarter, because they talk about that's what most people do on average for living expenses. And so you add that up, yeah, it's about 10 grand, I think, a quarter. My chiropractic journey, you have a lot of people in chiropractic that had a miracle thing happen to them when they were kids, kind of like the guys hearing coming back. When I graduated Clemson, I was in the movie business, building sets for TV commercials and those types of things. And then I blew up my back, and I was only about 24 years old. Spent 3 days laying on my back, having to crawl back and forth in the house, those types of things. Didn't do anything about it. I wasn't into chiropractic at the time, and then it got better, and I was told I was always going to have back pain the rest of my life. When I decided to look into a job for myself, I worked for corporate America, and so they're going to downsize you when they want to, so that gets a little annoying. Worked for the Atlanta Braves for a year. That was a cool job, but didn't pay any money. And so I had a wife, had a child, so you got to find something that you can do. And I decided, well, I would, instead of letting corporate America decide whether or not I'm going to survive, I would rather let myself decide if I was going to survive. Passed the chiropractor's office, and I thought, well, I'll look into that. Then I went up to Sherman for their career day, loved it, and here I am. And so as I started but part of the requisite to get in there is you need to have a recommendation from a chiropractor. So I started getting under care, because I can't tell you that you need chiropractic care if I have it off, I don't put myself through it. But as I got through it, all of a sudden, the back pain I don't have anymore, that went away. I hurt my shoulder playing football. I've never had my shoulder adjusted. That pain's gone. I don't suffer from it anymore. Sniffles and colds and all those types of things, for the most part, I get. If I do get them, they last very briefly. And the reason is the immune system's working pretty well, but again, which is governed by the nervous system. And so my daughter, she was 7. She was born in 1995. My wife had a real tough labor. She actually pushed, ladies, you'll enjoy this, for about 8 hours, every 5 minutes, contractions. She was turned the wrong way, all those types of things, and she was flat miserable. At one point, I went to the bathroom, came back out, and they had her up on her feet, because they wanted to have her squatting, because they let gravity drop the baby. I don't know how the hell they got her up there, because she was, had this epidural going on. So finally, she was born, but they put the little vacuum on her head, sucks her out, but that puts a lot of pressure on the spine. So my wife's first moments were she actually passed out in the bathroom because she had lost a lot of blood and all that type of stuff. So that was childbirth for her for the first time. Sarah probably had ear infection upon ear infection. She had tubes twice by the time I think she was 2. And that's a fantastic thing, handing over your 2-year-old or your 1-year-old to have surgery done. And that's how she lived life. She just thought an ear infection was normal. She would drink that paint off mint and stuff like it was nothing. The antibiotics just didn't touch it. She started getting adjusted when she was 7, and a lot of that stuff's cleared up. She doesn't miss school. She's a really good soccer player, wants to play here. Pretty healthy kid. My son was born 8 years after Sarah was. He was adjusted the day he was born. And I check him every week, and my daughter's spinal easily pediatrics is that big, his spine's about that big. And when he gets his checkup, they would ask my wife, well, you must really enjoy being home with your son. She goes, what do you mean? I work. Well, he's so healthy. Well, we keep him in a daycare. Well, that's impossible, because you hear about snotty little kids in daycare. He's out there breathing the same air that they are, but his body's working better. As far as, if it's a genetic thing, well, why isn't he as bad as Sarah was? He's got the same genes. And so, but he got a better start than she did. And so my motivation for going out and talking and adjusting people is the 7 years that Sarah didn't get it. And so that what makes me excited. So that's pretty much my story. I know that was kind of quick, but any questions? Go ahead.
As for when you're going through chiropractic school, I know you briefly touched on it, but course-wise, how is it, are you learning about each system, or how is the overall thing kind of outlined?
The way they do it, chiropractic, you have to have there's 4 sections of the board exams, and you don't have to take them all at the end, you split them up. So the first 6 quarters, I believe, that's all what they call part 1, and that's you're taking anatomy, you're taking neurology, you're taking nephrology, all the ologies. You take probably just about every one that you do. Then after that, you start getting more into the chiropractic side of things. But you do things, you go over x-rays, you look at all sorts of tumors, you look at all sorts of arthritis. We're not radiologists when we get out, but we do know what normal is. We're real good at normal. So if something shows up, like it's a spot that you think might be a tumor, then you know to refer them out to get it checked out and find out what it is. Because oftentimes if people, a lot of times people have a tumor, they don't know they have it. But they happen to come in because whether they got some sort of pain, you take a picture of a spine, boom, and all of a sudden there it is. Aneurysms are popular things to find, and those types of things. So you take probably where medicine goes into diagnosis, and we're off on, then we split off and we're looking at locating, analyzing, and correcting that subluxation, figuring out what's going on with the body. So that's where they diverge. But as far as the just typical class hours, probably about the same. But all your basic sciences are first, and then you get into the chiropractic stuff. Now, you do start as far as techniques, palpation, feeling up and down the spine. You'll start that day one, and then certain adjustive techniques. You don't adjust until about 7th quarter, I think. That's when you first get into the clinic. Then once you're real good at the setup, anybody can put a push into the spine, but you hurt if you don't do it the right way at the right time. And so they want to make sure you're really good at setting up, and then you adjust that first time.
So it's 7 quarters till you get patient contact?
Right, and what you'd actually do for the first quarter that you're in the health center, if you and I were in class together, we would be what's called reciprocants. So then I would work on you and you would work on me, and that would be it. We wouldn't work on anybody else, so we could just screw each other up, and that's about it. But then once they feel comfortable that, I'm taking care of you, you're taking care of me, then you go out and you build your own practice. But it's based in that health center.
Now, did you buy out your practice from someone else, or did you just create it?
I started out as an associate, worked with another chiropractor, and then when we split ways, I just opened my own in the office. But you can certainly buy one out. Some people do it that way. Some people end up, they associate or work together, for a long time. I in my office, I'm in. Yep.
Now with chiropractors, is it all just kind of general chiropractors? Do different chiropractors do different? Is there any type of specialty?
You'll have some, we have to get continuing ed like medical doctors, dentists, and all those folks do. So some may specialize, we'll call it sports. That's where it gets kind of elusive a little bit, because you're starting to get into physical therapy around there. And to me, if you want to be a physical therapist, go to physical therapy school. You adjust the spine, and that's it. That's the specialty. So depending on the insurance company, we're called specialists just because of that reason, dealing with the spine. But a lot of people do go, they'll handle sports. There is a pediatric, you get certified in pediatric chiropractic. Because obviously how I would adjust you is a whole lot different than how I adjust a newborn. And so knowing how to do that is important, those types of things. So that's probably where it is. You'll see board certified and all these types of things. Well, if you have a license, you have to be board certified. We all take the national board, so that's just something to put on the yellow pages, make them look good.
Is most of chiropractic stuff like just manual, popping, adjusting?
Yeah, it depends on the technique. There are some techniques that use it's a handheld machine, I guess for lack of a better word. It's kind of, I should have brought it, it's kind of like a little jackhammer almost, and it'll put in a thrust. When we say that something's misaligned, because I think the medical version of a subluxation is right up until the point it dislocates. That's what the subluxation is. But when we talk about a subluxation, it's millimeters, which you'll see on an x-ray. You can see that there's a misalignment. For my subluxation model, can you see hang on a minute. See the green light blinking? And then we just turn it a little bit, and then it slows down. So that's kind of what we're talking about with the pressure on the nerve. So it's just it's a small little movement, and so we just put the quick thing back into it. As far as all that was.
And as far as, it's hard to put costs on things, but like a typical charge for a simple adjustment.
It depends probably around here, and if you go in Greenville, it'd probably be anywhere from typically 30 to, it could be 45. It's whatever the chiropractor feels it's worth, and it's whether people feel like paying them or
Is that the copay for insurance, or is it just?
That'll just be the fee, and the copay is whatever the copay is. The way I do it, I actually want to be more of a cash practice, one that makes it more affordable for people.